Hi everyone, my name is Gregory. Today we're going to discuss quadrant case. We'll prep the case number 29, 30, and 31 in one session. But I want to show you also and share with you my mistakes, how I approached this case. So let's start from the x-rays. Crown number 31 is done a couple of years ago. That's by Emax. And again, it's we're taking pictures, post-op pictures, and see how the margin fits. And by taking these x-rays, it looks perfect. The patient was dismissed. But you will see that when the patient came back for her regular checkup, and we took a bite-wing x-ray, you will see how the margin fits. So everybody will make mistakes. I made a mistake, and I want to share with you how to approach the case. The lady has secondary cavities under long-lasting restorations number 29, number 30. So we have to change those crowns. They are connected with each other. So that's why I start this case and prep the case 29, 30, and 31 at the same time. And also we can see that probably the root canal was failed originally, and the patient went to oral surgeon where the apicectomy was done. And I told her that number 30 is an questionable prognosis, and she was aware that if anything happens during this procedure, we might probably extract number 30 and maybe just placing the implant, or we'll do 3-unit bridge here. So this case, once again, being approached as in one visit in a prep disease number 29, 30, 31. Also, the patient is an elderly woman, and she is medically compromised, taking a lot of medications, and it's going to affect our tissue management in this case. And I'm going to share with you what I was done in this case. So the patient came back. It's for bite-wing. You can see that my margin is way from the actual margin it's supposed to be, but there is no cavity. The patient not complaining. I understand that the root canal was done. But look at this x-ray, I said I have to redo my crown, and it's not perfectly fit. So and I offer here that's free of charge, redo this crown, because it's not it's a standard of care. We can see also this, there is a little opening, there is a cavity here, and a cavity also on the buccal side of number 29, and we had to change those crowns. So let's see this case clinically. You can see it's the crown was done probably previously, and the patient developed some kind of symptoms, and the root canal was done. And once again, the root canal was failed because it broke the instrument, and apicectomy was done. You can see my number 31 crown Emax was done, but again, we have to change it due to poor fit. And I want to make sure the crowns are gonna last here much longer. So I finally prepped the teeth, and you can see that I remove secondary cavities all around the restorations here, and you can see the margin very subgingival on number 31. You can see also the crack lines on number 30. It's probably maybe one of the reasons is the root canal was failing, besides the broken instruments and pool condensation, because what statistically showed is the most root canal fail from a coronal leakage. So in this case, I know as I told you before, patients taking a lot of medications. She's medically compromised, and how would I approach the case to make sure that my margins can be readable when I scan. So I use my soft tissue laser by Picasso, and I remove all the granulation tissue. So make sure that when I place the cord, there is no bleeding around it, and I can manage the tissue and work on the model. So when I remove soft tissue, granulation tissue around it, and I use cord material by Alterdent, and in this case I'll be using cord size number 1. So it depends on the soft tissue, especially if you're doing front teeth. Depends on the soft tissue thickness. It means biotype. You use different size of the cord material, so make sure you don't end up with the big recessions. So in this case, I pack the cord all around it, and it stays around the cervical part. And what I did also is I've been using viscostat hemostatic agent all around to make sure that I have tissue control, there's no seepage. I know it's, we have a lot of discussions. It's am I discolor the restoration, or any kind of side effects. But again, I'm sure that I'm using microabrasion when I clean my preparation, and it's and trying to remove all the viscostat residue wherever it's going to be left. But I want to make sure I control the bleeding. The another side effect by using viscostat or any kind of hemostatic agent, it's acidic in nature. If you have the teeth which is still vital, it might cause sensitivity. People sometimes blame that the cement, the restoration, the preparation, but sometimes the chemical agents you've been using during your dentistry might cause sensitivity. Usually will go away. Another reason of sensitivity also in this case, if dose is going to be vital, because you remove the soft tissue, you expose the root part, and sometimes the root part is going to be open to environment, and people feel the sensitivity. I had several cases when the patient come back to me, and we just put like a bonding agent or like a fluoride gel to cover this area, and people, the patient feel better. So in this case, once again, you can see my cord almost at the bone level, and I'm not sure. So probably if we have like a biological width here violation, we probably might do crown lengthening technique, but I'm not sure, so we probably might get away from that. So the preparation was done, and let's see from the buccal view, and I have enough clearance in this case, so not worried that my the restoration will be jeopardized. And what I was doing is I'm trying to check my bite, so make sure it's right. But once again, you can see here the patient was numbed, and we're taking buccal bite, and the picture you can see the patient is not fully in occlusion. Sometimes what happens when we're taking buccal bite a scan, and the patient is not fully bite. And another reason that sometimes we have occlusal discrepancy, even doing like a quadrant cases, because there is no support in the back in this area. Sometimes patient bites and squeeze against it's on opposing arch and produce the red contacts in this area. So let's go with another image. Again, I prep my teeth and I developed the restoration number 29, 30, 31. I cement them with NX3 bonding agent, and I use Unisem 2 as cement. And this is the buccal view of the restorations, and you can see the final X-ray. So you see the margins perfectly fits. There is no open margins. You can see those old restorations I've been placing the Emax on number 3, number 4. So patient is happy, and I'm gonna post some pictures after 3 weeks when the patient healed up. So the next step, I'm gonna show you how I designed those teeth, and I'm gonna show you my RCT file from start to finish. So this is RCT file. We designate number 29, number 30, and number 31 as a crown by generic individual, and also designate the material we're going to use. In this case, we're going to use Emax. So we're going to proceed with acquisitions, and you can see this message is going to come up because I'm working on my desktop, and the image has been taken. You can see the images, the margins are clear on number 29, number 30, but we're going to have a challenge to do the marginations on number 31. So I want to show you how many pictures I have on my master model. So let's see the opposing arch, and we can see how many images we have here. That's 8 images. When I do a lot of the restorations on one quadrant, the quadrant key especially, trying to do the almost half the arch, so I can make sure that my bite is right and I can have a reference point. This is my buckle view. I have only 2 images. You can see it's where they belong. It's I'm trying to take images on the front area, and let's proceed with the buckle bite. This is a buckle bite, and I want to make sure that my contacts are good, and you can see the contact points on a canine. That's what's supposed to be. It's and on the cuspus of the first premolars. So we'll proceed with margination. You can see that's already marginate number 29. So let's do number 30. And it's going to be much easier to do it here. So I'm gonna make sure it's I'm alright everywhere. Again, I'm working from my desktop, and everything you see, it's live. So that's number 30. Let's go with number 31. As I told you, this is gonna be a challenge. So I usually in this case I'm trying to do and black and white mode, so I can see all the margins. It's gonna be a challenge here to do the margination. The reason is I was doing a little crown lancing procedure. You can see a little bit of soft tissue tag on mesolingual area. So I want to check again. It's why my margins are not exactly where it's supposed to be. Okay, so let's define our axis. So make sure it's mesial to mesial, distal to distal. So let's do the same with number 30. And click OK. And let's check number 29. So it's already done. And we click OK. Now let's proceed with design. So I told you before that I'm going to design 3 T at the same time. That's what the beauty of 4.0. I could probably break this case on Sarman's technique, but I want to show you what probably the most of the users are going to use and not familiar with Sarman technique and what can be done. So as I told you before, I'm going to start doing from the basic level to show you how I approach this case and what can be done. So usually you can do number 29 design first, let it to mill, then you design number 30, then again send to mill, then design number 31. But what I want to do is sometimes most of us making mistakes when we prep the teeth at the same time, and then we start designing and milling at the same time. It takes longer than just to break the case individually. You can see this on this model when I do the proposal, where the most of the contact points is. I'm trying to do contact points on a cusp to fossa relationship, so it'll be less stress to the teeth. So it looks alright, but we can probably work on number 29 a little bit, do a little bit of rotation in this case, and I can probably move a little bit that way. Yep, I like it. So I also want to bring our upper jaw and to see how they relates to the occlusion. So make sure it's the bite is good and position of those teeth is good also. At the end of the my procedure, I'm gonna adjust number 2 crowns to make it even with the rest of the teeth. I should probably do it before I take the impression, a digital impression, and make the number 31 more nicer. So, but I'm gonna take this in consideration and design my restorations. Okay, so let's check our contact areas. I want to check number 30. Okay, the contact's a little bit high, so I have to adjust it. Okay, now let's do number 30. So, okay, right here. So I'll make sure when I move, I'm not overextend my margin. Okay, it's great. Let's go on number 30. Contact is great. Just a little bit adjustment here. Okay, now let's number 31. And again here. I like what I see so far. So then we're gonna proceed with milling, and the case is done.